Today, we're talking about a drug called Febuxostat. It's an absolute powerhouse when it comes to treating gout, which is, one of the most painful kinds of arthritis out there. But there's a serious catch. The story behind this drug is way more complicated and honestly a bit more dangerous than you might think.
So let me ask you this. What if you found a medicine that worked wonders, but it had a dangerous secret? What would you do? That's the exact question, the real dilemma, we're exploring with Febuxostat.
Okay, so before we can really get into how the drug works, we've got to understand the problem it's trying to fix. And that problem is gout. So what is gout really? Well, at its core, it's caused by these tiny, sharp, needle-like crystals. They're made of something called uric acid. And when you get too much uric acid floating around in your blood, that's a condition called hyperuricemia, these nasty little crystals can start to build up in your joints. The big toe is the classic spot. And let me tell you, the pain is just excruciating. All right, so where does all this uric acid even come from? The best way to think about it is like a little assembly line inside your body. Step one, you've got these things called purines. They come from our food and also just from our own cells breaking down. Step two, a super important enzyme called xanthine oxidase comes along. It's like the main piece of machinery on the line. Its job is to convert those purines into, well, you guessed it, step three, uric acid. The problem with gout is when this whole factory just goes into overdrive. Okay, so that brings us to the solution. If the problem is a factory that's running way too fast, what's the logical thing to do? You've got to slow it down, right? And that is where Febuxostat comes in. Febuxostat's approach is actually pretty brilliant and direct. It goes right for that main piece of machinery on our assembly line, that xanthine oxidase enzyme, and it just blocks it. It puts a wrench in the works. And when you block that enzyme, you shut down the entire production of uric acid right at the source. Simple as that. No machine, no final product. And listen, the goal here is super specific. We're not just trying to lower uric acid a little bit. The magic number doctors are aiming for is less than 6 milligrams per deciliter. They want to get you below that number and keep you there. So why 6? Well, it turns out that below that level, those painful crystals literally can't form anymore. Even better, the ones that are already in your joints start to dissolve. It's a total game changer. But here's something that really throws people for a loop. It's a total paradox. If this drug is so amazing at getting rid of uric acid, why on earth do so many people get worse gout attacks right when they start taking it? It doesn't make any sense, right? Well, the best way I've heard it explained is to think of a snow globe. Imagine all those uric acid crystals are like the little snowflakes settled at the bottom. They're just sitting there dormant. When you start taking Febuxostat, it dramatically drops the uric acid level in your blood. It's like you're picking up that snow globe and shaking it hard. All those settled crystals get stirred up, and your body freaks out, launching this temporary inflammatory storm. And that's why doctors almost always have you take an anti-inflammatory, like an NSAID or colchicine, for the first 6 months or so. It's to calm things down while the storm passes. So up to this point, Febuxostat sounds pretty incredible, right? Almost like a miracle drug for gout. But this is where the story takes a very sharp and a very serious turn. And this is the absolute crux of the issue. After a huge clinical trial, the US FDA slapped what's called a black box warning on this drug. Now, you need to understand, a black box warning is the most serious safety warning the FDA can issue. It's a huge deal. And the reason they did it, the study found an increased risk of death from heart-related problems, especially when you compare it to the old-school treatment. So yeah, the big one, the headline risk, was cardiovascular. We're talking heart-related death, non-fatal heart attacks, and strokes. But that's not all. There are other pretty serious risks to think about, even if they're less common. Things like potential liver toxicity, and even some very rare but truly life-threatening severe skin reactions. So this black box warning completely changes the conversation. It forces us to ask, okay, how does Febuxostat really stack up against the old champion, the drug that's been the first choice for gout for decades, allopurinol? It's time for a showdown. Now, both of these drugs work by blocking that same enzyme, but they're not identical. Febuxostat has one huge advantage, especially for people with kidney problems, which is super common if you have gout. See, Febuxostat gets cleared out of your body by both your liver and your kidneys, so you usually don't have to mess with the dose. That's a big plus.
But, and this is a massive but, you have to weigh that benefit directly against its biggest, scariest disadvantage, that cardiovascular safety warning. And that's a warning that allopurinol just doesn't have.
Okay, so you've got this powerful drug with a huge upside for some people, but also this really serious risk. How in the world do doctors and patients navigate that? How do you make the right choice?
Really, it all comes down to one single question. With everything we know about the risks, who is this drug actually for?
And thankfully, the answer is pretty clear. It's laid out right in the clinical guidelines. Febuxostat is not a first-choice drug. It is what we call a second-line therapy. That means you don't start with it. It's reserved for very specific situations.
So what are those situations? Well, Febuxostat is really meant for patients with gout who've already tried allopurinol, and one of two things happened. Either it just didn't work well enough, they couldn't get that uric acid level down below 6, or they couldn't tolerate it because of side effects. For that specific group of people, Febuxostat isn't just an option, it's an absolutely essential tool.
And that really leaves us with a bigger question to chew on, doesn't it? The story of Febuxostat isn't just a story about a gout medication. No, it's a perfect example of one of the biggest challenges in all of modern medicine. How do we balance a drug's incredible power against its potential peril? It's a constant reminder that for just about every powerful solution we discover, there's a complex and sometimes difficult calculation of risk versus reward.